you. Well, good afternoon. Thank you for inviting me to share our experience. So, as Adrienne said, attention given to psychological implication of sickle cell disease assures a better quality of life. But note that. Therefore, we must pay attention to these implications along the different moments in life. So the first slide. Adolescence is a time of crisis. It happens a lot of changes at this time, at this moment. It's a period of life where there are many changes and adult subjective position is being acquired. So adolescence implies leaving behind childhood. It means separation from the parents and considering parents as the ones who guide and organize the priorities of life or daily life. There is also an expectation of gaining autonomy, but this is something that is result of a process, and the process starts before adolescence. There is a moment when relationship with peers is very important, and when parents have to be able to gradually let children take responsibilities, make decisions, and assume certain risks in order to promote autonomy. So at this period, adolescents have to find his or her own place in their group, build a social network, learn if it is better to say yes or no, without having their parents' help to deal with the group as when they were children. Body changes, sexuality is very important, as well as the changes in the way of thinking, because they are capable of abstract thinking and start questioning about their place in the world, the meaning of existence, and the meaning of life itself. So it is a moment in which future appears not as when I would be adult, but when becomes real. Living with a long-term condition like sickle cell disease during adolescence constitutes a significant challenge. For adolescents with sickle cell disease to be cared for and supported appropriately, it is crucial that parents and health professionals have a comprehensive knowledge and understanding of how they experience living with the condition. The next. It's a time when the future appears as the next exit. So there is not the next one. There is not a one-size-fits-all to cope with sickle cell disease. There is no a good way to deal with this challenge for everyone. Each one must do his or her own process to find their own way to deal with this chronic disease. And as it is a process, the adolescent requires time and adequate follow-up. And that's the reason why mental health professionals are necessary, a part of a team. When the psychologist is involved in the treatment, science diagnosis, parents and adolescents tend to ask for help when needed. At this time appears a lot of questions about disease and treatment. Despite the years of follow-up, they wonder about the need for treatment. For example, an adolescent this week start to ask, why do I take hydroxyurea and penny level if they don't cure anything? So it's a time when it is necessary to talk again about the disease, about the silent damage it produces, the difficulty of infections, and the convenience of antibiotic treatment. It is a time to talk about their tastes and habits, to be able to explore how to accompany them to find the things that give them satisfaction in life. And this is different for each person. In this sense, stimulating from a young age to find things that they like and that are compatible with the disease is very important. The next one. That's why we work as a family-centered care. So it is important to work with parents in order to support the children looking for the things that do well. So these are the challenges that an adolescent face. Above all, they have to learn to deal with the constraints imposed by their condition. When they were children, their parents put the limits, made decisions, and helped them to deal with frustration. But at this moment of their life, there are a lot of limitations that the illness imposed to them. So adolescents with sickle cell have to adjust to the constraint of living with a lifelong chronic condition and developing compliance with self-care and medical treatments can be problematic. Because social functioning, it is also an important issue because their experiences are different from those of their friends, and they sometimes miss vital moments because of crisis of pain or admissions. So it is difficult for them to find their place in the group. Sometimes parents overprotect them and so don't let them to have their own experiences. So it is difficult for them to deal with this condition, and they have fears of a stigma, of stigmatization. There are a lot of factors that contribute to stigma in sickle cell, not only disease status, pain, and use of painkillers, but also sociodemographic characteristics, and it is difficult for them to explain and tell others about, talk to others about the disease. So disclosure is also a thing that we must address in the follow-up, because it is difficult to reveal sickle cell condition to the others or speaking with others about illness. But we all know, and there are a lot of studies in this sense, that people with sickle cell disease that can speak and talk to others, family, friends, about their pain, have more positive adjustment and are more likely to seek care and have lower awareness of stigma or stereotype. But adolescents are also at risk of internalized stigma and feel depressive symptoms, including feeling hopeless and loss of interest in daily activities. All of these have been associated positively with stigma, internalized stigma. Another important issue is that they can't play sports or do physical activities, and frequently have problems at a school with the sport teachers. We have a lot of work with the schools in order to speak about the disease, because as Adrian told us, it's something that you can't see, and frequently teachers think that children or adolescents are lazy or doesn't want to work or are not serious at work, at a school. Sickle cell disease also affects body image. There is a very frequent complaint about yellow eyes, or sometimes they have other problems. For example, an adolescent that doesn't want to go to school because he had thrombosis in her limb, and so she was ashamed to go to school, thinking what their colleague would say. So many patients refer feeling uncomfortable with their image. This also leads to problems of self-esteem and self-confidence. The earlier we detect these problems, the better we can help them to solve. We found something very, a contradiction in adolescents with sickle cell, because they may be more mature in their awareness of what matters in life, but they also experience estrangement from their peers, as well as lack of resources and social skills. So how to deal with that feeling different? What to do? The next one. What to do? Well, which are the important issues to address with adolescents? Well, so what are the important issues to address with them? What do must speak when we are in the consultation with them? The first, knowledge and understanding of the condition, because they change and new questions may arise, and it is important to maintain open communication. Then, symptom experiences. Each individual has its own relationship with his or her body, so each one experiences symptom and especially pain differently. It is important to identify which are the best way to deal with it for each one. A variety of psychological characteristics are associated with pain, including coping strategies, anxiety, depressive symptoms, and stress. We must pay attention to each adolescent and help them to identify and communicate symptoms as soon as they appear. Then, self-management and healthcare experiences. We must help them to pay attention to what they feel, to get to know themselves, to identify what helps them and what makes their situation worse. Learning to communicate their thoughts about the disease to adults, asking questions, beginning to participate in decision is very important, and they need the adults to stimulate and promote this process. This is linked with adherence and attitude to treatment, because it is frequent to find that adolescents go through periods of poor adherence. It is important to talk openly about it and negotiate with them about the treatment. We must ask also about social relationships, being aware that, as I said, it is central in this period of life, and it is important to talk what to share and what to talk with others about the disease and treatment. Because what we find is difference and striving for normality in them. There is always a feeling of not having a normal life. So it is important to talk about the difficulty that the disease supposes, but also to help them to realize that life puts many difficult circumstances ahead of many people, and the important thing is what one does with the cards that have been dealt to anyone in life. In this way, we can help them to see that their life and their identity is much more than sickle cell disease, and we prevent them from turning the disease into a stigma, a barrier, a destiny in their lives. This is difficult and it's a process because it's true that, for example, the school experience is highly disrupted by absence due to crisis, hospital attendance, and admissions. In each case, the process must be accompanied, although in our experience, we see that patients have great difficulties in attending school. So we must address emotional well-being and coping, and also sexuality. And this last point is difficult in the pediatric setting because usually patients came with parents, and so it is a process to start having a special consultation with them, or a time in the consultation with them to speak about sexuality issues. The next one. What we know is that subjective perception about sickle cell impact in their lives is a key element in emotional well-being and quality of life. We can help them to adjust goals and expectations. This is something that everybody has to do during adulthood. But with adolescents with sickle cell disease, we must help them to integrate sickle cell disease to their identity, as well as feel their life it's much more than sickle cell related issues. The next one. As adolescents is a transition at certain point, you have to cross the river. The next one. So transition to adult unit. The goal is the continuity of care, and this is a high-risk period associated with increases in hospital admissions and death. The factors underlying this increased risk include not only characteristics of the disease itself, with the accumulation of disabilities and progression of organ damage, but also psychological factors and frequent paucity of adult care resources. So leaving the familiar pediatric team can cause marked anxiety in many patients. As we have said, transition of care coincides with many of the other transitions that characterize this time of life. So the shift from protection by parents and physicians to independent self-management may be difficult. The transition must begin early, involve both pediatric and adult team, direct appropriate attention to the parents, and occur over a period of several years where we can work with parents and adolescents in order to start caring themselves. So for this happen, it is necessary that they establish a relationship of trust with health professionals, that they get to know adult doctors and establish a relationship of trust with them. Confidence in medical decisions and the belief that the doctor is one of those who cares and helps to live better is the best to poor adherence. The best antidote to poor adherence is confidence in doctors. Then a very important aspect that Decio talked about in the blog, a very important aspect that appear in adolescents is the overuse of painkillers. It is a very difficult topic to deal with. On one hand, it is important to have easy access to opioids and other painkillers, but we must educate about responsibility in the use of them, and we must be vigilant when we see excessive use so that this not become a taboo subject. The worst is that it becomes something that's not talked about. The next. we have identified several follow-up barriers, and it is important to address this. It's important to know. One is the relationship with the pediatrician, because sometimes families felt fear of abandonment, and they are afraid of abandonment and experiences difficulties transferring trust to the new team. Also, lack of knowledge or understanding the sickle cell disease and the risk it has, because you don't see the illness, and sometimes they negate the symptoms. It is very often in adolescents to negate some symptoms. Also, because lack of access to healthcare facilities. And another important follow-up barrier is the psychosocial problems. So it is important to address in the pediatric setting. So I think that this is important, what Decio said, that being more aware of these issues help us to advocate for mental health service, and to work better for future generations. Thank you.